So we go straight into the conversation. So why are do we want to have a discussion on the low health insurance uptake in Cameroon? You know, Cameroon has multiple health financing strategy from multiple sources, for example, from development partners, from the taxes, and from contributions from households. And there's a famous out-of-pocket payments which users need in order to access quality healthcare services, which has led to numerous challenges in terms of access. You know, the household income of an ordinary Cameroonians is extremely very low, and therefore people encounter a lot of difficulties, such as catastrophic expenditures when they want to access quality healthcare. Understanding this limitation, the government of Cameroon saw the need for a social health protection policy in Cameroon, and in 2006, a strategic plan for health insurance was developed and implemented with the objective of having at least 40% of Cameroonians covered by a health insurance scheme by 2015. And the question is, if we are above 2015, how many Cameroonians are covered? The statistics are still very, very limited. And therefore, that is why we want to talk about the barriers to low subscription as far as health insurance schemes are concerned. And you know, in Cameroon, we have three main insurance schemes. We have the national health insurance, which does not cover all Cameroonians. We have private health insurance, companies that are providing insurance services to the public in relation to health. And we have community health insurance schemes, precisely mutual health organizations that have been existing in Cameroon for several years now. So this webinar is like putting two in one to be able to take stock to find out what's happening in terms of subscriptions. So the objective of this webinar, we want to try to address or to find out what are the challenges faced by the nationals, the Cameroonians in subscribing to a health insurance schemes, and what is the impact of this low subscription to the Cameroon health system. We want to discuss some of the strategies that the government has used to promote health insurance uptakes, and what else can be done to increase subscription into health insurance schemes. So these are the objectives of this webinar, and we'll move straight to discuss on this issue. We have able panelists that we've invited, and we're very grateful to have them present. He holds a PhD in population and health. Therefore, he's a health scientist and is currently lecturer in the Department of Population and Behavioral Sciences, the Fred Binka School of Public Health, University of Health and Allied Sciences. He's also an adjunct faculty with the Department of Health Sciences, University of the People in the USA, and UNICAF University in Cyprus. You are welcome, Dr. Hubert.
Thank you very much.
Okay. Yeah, we also have Dr. Leo Donatus. He holds a master's degree in public health with specialty in epidemiology and reproductive health, and has 12 years of working experience in the field of reproductive health and epidemiology. He has a record of excellent leadership positions in private and international organizations. He provides consultancy services to the United Nations in reproductive health in emergencies, implementing minimum initial service package in crisis and disaster management situations. Mr. Leo Donatus, you are welcome.
Thank you very much, Dr. Constantine.
Okay. Yeah, next among the panelists is Madame Mildred Njamsi. Njamsi, she holds a master's degree in health economics, policy and management from the Catholic University of Cameroon in Bamenda. She works with the Northwest Special Fund for Health Promotion. She coordinated the setting up of community-based health insurance organizations, also known as mutual health organizations, across health districts in the Northwest region of Cameroon for many years. Madam, it's an honor to have you on this panel.
Thank you, Dr. Constantine.
Okay, that said, we go straight into the discussions. So as I said, just as a reminder, we are looking at our focus is on two types of health insurance schemes. private health insurance schemes and community-based health insurance schemes. And I believe our panelists will cover this domain. So the first question I'm presenting, we also, one of the panelists is Dr. Ghislaine. Unfortunately, she has not been able to join. We are hoping that in the course of the conversation, she will join us. In the meantime, we will go ahead with the conversation. And we're going to address the first issue, which has to do with looking at the challenges faced by the Cameroonian population in enrolling into private health insurance schemes. And I'd like to address this question to Dr. Hubert. Can you say something about subscription into private health insurance schemes in Cameroon and beyond?
All right. Thank you very much, Doc, and thanks for the opportunity to be a panelist in this very important webinar. What have been the challenges that have militated against successful uptake of health insurance, especially at the private sector in Cameroon? I think this is a big discussion, and so I will just take a little bite, and as we go ahead, we would address them more across about 28, sometimes 30 countries. And we realize that the challenges seem to be similar. Yes, the challenges might be more in some countries than others, but then they seem to be common across the sub-Saharan Africa. One, education is a major issue. We have found important relationships between high levels of education and then successful uptake of interventions, including the health insurance. And so our studies have shown that the higher the level of education, the more likely the individual is able to subscribe to the insurance schemes. And so the same applies to Cameroon. And so as the level of education for a lot of the population is low, that has largely militated against subscription to the scheme. Now, one other thing, there are so many, but I'll just speak to this other one apart from education so that others can also speak, is about premiums that people have to pay to get subscribed onto these schemes. And we've all agreed that the majority of sub-Saharan Africa, including Cameroon, fall within the lower and middle income country zone where poverty levels are very high. So because of that, people find it difficult subscribing to these schemes, especially the private ones, where the costs, the implications of subscribing have higher cost implications to these people. And so people who live below the poverty line are therefore unable to subscribe to these schemes. There are a number of factors, but then I will limit it to these two. As we go ahead and I have to come in, then I will bring in more factors. So I think these are some of the factors why private health insurance uptake is low in Cameroon. Thank you very much.
Thank you very much, Dr. Hubert, for that contribution. And as you say, as the discussion unfolds, more will be coming up. Now, I want to ask a similar question, or repeat the same questions, but with respect to community-based health insurance schemes, also known as the mutual health organizations. And we would like to hear the experience from Madam Mildred. Madam Mildred, you have the floor.
Thank you, Dr. Constantine and the other. I would like to say here that one of the major problems or challenges of community-based micro health insurance schemes is lack of the involvement of the consumers in the design of the insurance product. That is a major project because once the needs of the populations are not determined together with them, there is less appropriation of the scheme. And equally, once the insurer does not analyze in relation to demographic characteristics, does not analyze even the socio-economic environment of the population. It means that the population or those to consume the products will not master the product. So lack of involvement of the consumers in the design of the scheme is a major challenge. Otherwise, if the consumers were involved at the beginning, they will master and appropriate at the end. And that would even assist the insurer to master a number of things relating to age, relating to gender, relating to even population size, and even the household heads. And that can lead to growth in the mutual health organizations. The second the challenge is lack of trust. Lack of trust on the part of the insurer, especially as the sector is not regulated by the states. Most of the people think that it's something that belongs to a particular group of people and they want to make money. So they do not see the advantage of risk sharing. Another problem too is unsuitability of the insurance products available. Sometimes because the insurance product designed without the involvement of the population comes out to be very unsuitable to the population. And so it doesn't answer the needs of the people and they don't find it interesting to buy. Again, relating to mutual health organizations, there is this idea of static premiums. Once the premiums are calculated at a particular period in time, they stay on for a very long time while the economy keeps changing. And so the market price is changed, and at the end of the day, the market at the level of the health facilities is not the same as the market at the time of the design of the schemes. So at one point, the population does not feel interested to buy the insurance product. Thank you. Let me allow others to continue from there.
Okay, I want to thank you very much, Madam Mildred, for that brilliant contribution. If we look at the from the contributions we've gotten so far relating to the challenges faced by the population in enrolling into these two different types of schemes, it's not really promising. And the question we'll be moving to is to find out what is the impact now that there's low subscription. If, for example, we want social protection coverage for the population in order to mitigate the fallout such as catastrophic health expenditure or having difficulties in paying for healthcare. And these are the alternatives that have been suggested to our population, and there is a lack of uptake. It really calls for concern. But before we proceed, let's try to find out what is the impact of this low subscription to a health system like the one of Cameroon and across other African countries, because as we said, despite the specificity of the context, there are similarities. I mean, the problems are the same. If you look at the literature, the challenges are very, very similar. And now we want to find out how does this impact a country's health system as far as healthcare financing is concerned. And I want to hear from Mr. Leo Donatus. You have the floor, please.
Okay, thank you, Dr. Constantine, for giving me the floor. I would like to start by reviewing a brief about the health system, and then I will go through the impact. And I will just take a snapshot, which we know the health system of Cameroon, which is adopted by Cameroon, is having the government and the management team. Then we have the team for the human resources. We also have health financing, which comes from taxes, like you earlier mentioned. And then also we need an aspect which is often not utilized as much, which is the artificial intelligence collection of data into the health system, which is not optimal. Now, looking at the health system that we have in Cameroon, we know that the impact of low subscription relating to health financing is a challenge, because looking at it as an epidemiologist, I would say that when the population do not benefit or do not subscribe to this insurance, the out-of-pocket pay is high. And because of this, they shy away from visiting health structures in the country. This will, because of these challenges, most of the population wait until they are very, very sick before they come to the hospital. And we know that the hospital does not treat death, we treat diseases. So this will increase morbidity and mortality within the population as one of the impacts of low subscription that we'll be seeing. And I would also like to go ahead to say poverty remains a problem, and this contributes because the population is not healthy. Mobility and mortality has increased. There is low economic output of the population, and so this leads to low productivity and also a reduced life expectancy among the population. These are factors that cover epidemiological aspects. And also, one of the panelists has mentioned about trust. Most people still feel that, why should I, me not earning enough money, be able to go and insure or register or subscribe for a pay package that at the end of the day, I will not use it. For others who have subscribed, there is this peer influence in the community that is affecting the insurance subscription, which is some other people have paid their subscription, but the year runs out and nobody is sick, and so they feel discouraged to come back again and pay for and finance for these premium services. So that one is just an addition to the question, or to add on to what the other panelists have said on the question one.
Okay, thank you very much, Mr. Donatus, for your contribution. I just want to draw attention to the fact that Dr. Ghislaine Lenu is with us. She's one of the panelists, as she has just joined us. Dr. Ghislaine holds a master's degree in marketing and business communication and has a doctorate in social psychology, specializing in work and organizational psychology. She is an executive consultant at Prudential Beneficial Life Insurance. She is a specialist in marketing and operational management and a member of the $1 Million Round Table. Dr. Ghislaine, you are welcome to this discussion.
Je salue tout le panel, tous les panélistes. Je crois que la question va aller directement, enfin, la réponse ira directement à la première question, c'est-à-dire au sujet des compagnies d'assurance, au niveau de l'assurance vie, l'assurance maladie. En réalité, il faut commencer à situer un peu le Cameroun au niveau de sa situation sociale, économique. En particulier, elle est caractérisée par une exclusion sociale qui est quasi généralisée. Et cela favorise le développement d'un système qui explique le faible taux d'adhésion. Parce que l'assurance, en réalité, a un problème au Cameroun. Nous avons l'assurance vie et l'assurance maladie. L'assurance maladie est beaucoup plus considérée comme étant quelque chose qui renvoie aux élites, c'est-à-dire aux personnalités, à ceux qui ont un peu plus d'argent, parce que très peu de Camerounais prennent les devants pour souscrire une police d'assurance maladie. Et j'estime que c'est un problème de culture, parce que de plus en plus, la CNPS qui a été mise sur pied a essayé d'apporter un plus pour permettre aux compagnies d'assurance de développer le volet maladie. Seulement, ce n'est pas quelque chose de déjà perçu correctement par les Camerounais, parce que les Camerounais préfèrent aller directement se soigner, payent directement en espèces parce qu'ils veulent se soigner directement dans les centres de santé, dans les hôpitaux et payent directement et réservent beaucoup plus les mutuelles d'assurance et les compagnies d'assurance parce que ce sont ces deux grands groupes-là que nous observons dans le domaine. Il y a les mutuelles d'assurance et il y a les compagnies d'assurance vie privées. Donc, pour ce qui est des mutuelles, en réalité des formes de micro-assurance qui englobent les régimes d'assurance maladie destinés aux personnes à faible revenu parce que le régime d'assurance, il est communautaire et c'est volontaire. C'est un régime assez volontaire dont la filiation, elle est volontaire. Et elle se caractérise par une mise en commun des moyens financiers entre les membres d'une communauté pour compenser le coût des soins de santé. Parce que de plus en plus, on s'est rendu compte que l'assurance maladie est beaucoup plus réservée aux employés des secteurs publics et des secteurs privés formels, comme les entreprises telles que EDECAM, telles que Camtel, CNPS, qui en bénéficient. Donc, l'assurance, le régime d'assurance maladie communautaire privilégie la mise en commun du fait que un groupe ou une communauté de personnes peut se retrouver et partage certains traits, enfin, des personnes qui partagent des traits communs comme le métier ou encore l'ethnie, la situation géographique et peuvent mettre en commun des biens, des finances pour pouvoir garantir leur situation sanitaire, leur problème de santé. Donc, ce n'est pas évident au Cameroun parce que les mutuelles de santé peuvent être considérées comme des outils de développement parce qu'elles peuvent offrir des solutions alternatives de financement et d'accès aux soins de santé pour les populations vraiment à faible revenu, parce que c'est de ça qu'il est question. Les populations à faible revenu ont un problème avec l'assurance maladie parce qu'ils se disent qu'ils n'ont pas la possibilité de souffrir ce que les autres, ceux de la classe supérieure peuvent avoir. Si on prend par exemple la morbidité générale au Cameroun, elle est particulièrement élevée parce que selon certaines études, il y a près de 60% qui n'arrivent pas à faire face aux dépenses de santé. Environ 40 n'ont pas accès aux soins de qualité. Par ailleurs, la protection sociale publique est insuffisante. Parce que si on essaie de voir au niveau de les 15% de la population peuvent bénéficier, c'est-à-dire les fonctionnaires, ils peuvent bénéficier de la sécurité publique, les fonctionnaires, les salariés des secteurs publics formels. L'avantage en groupe pour assurer la santé avec celle de notre famille, cela augmente le nombre de visites médicales parce que de plus en plus, les Camerounais préfèrent aller vers des tradipraticiens ou alors vers les ambulants médicaux, ceux qui vendent les médicaments de manière ambulante. Ils préfèrent le faire parce que c'est moins coûteux. Ça, je parle beaucoup plus de la basse classe. Donc, le système de santé communautaire du nombre de ventes médicales, du nombre de consultations, de visites médicales, et il améliore l'accès aux soins pour les populations défavorisées. Il est important, moi je trouve qu'il est important que les mutuelles de santé prennent un peu de l'âge au Cameroun parce qu'elle n'est pas, elle peut pas, c'est-à-dire à un moment donné, tu peux te rendre compte que les mutuelles ne grandissent pas beaucoup parce que le système de santé camerounais ne les accompagne pas, à cause, par exemple, comme cause on peut noter la qualité des soins peu attractifs parce que de plus en plus dans les hôpitaux, quand on s'y rend, les personnes qui sont les mieux prises en charge, c'est les personnes assez nanties. Et les autres sont certes prises en charge, mais pas avec un service de santé de qualité. Ils ne peuvent pas en bénéficier. Donc, de plus en plus,
Alors,
l'absence de... Oui.
ok, oui, merci. Merci, madame. Je voulais juste pour dire qu'on va revenir sur ça. Pour le moment, vous avez entré dans un domaine où c'est la suite qu'on va regarder. Merci beaucoup pour votre contribution. Et ensuite, on va revenir sur vous. Merci. We want to thank Dr. Ghislaine for the elaborate contribution she's made, expanding on why the reasons for low insurance subscriptions. As I say, she belongs to the private insurance domain, but she's given a lot of ideas relating to community-based health insurance, as well as the health insurance architecture in Cameroon. So moving forward in what we're talking about, let's try to find out with the existence of these schemes trying to accompany the population to reduce the cost of care. Are governments doing enough, or are they doing anything in the first place? And if they are they doing enough to facilitate insurance uptake for the population? We'll look at it from two dimensions again, from the point of view of private health insurance and the community-based health insurance schemes. Madam Mildred, do you think government is doing enough to facilitate community uptake or subscription into health insurance, community-based health insurance schemes in Cameroon from your experience?
I would say yes and no at the same time. Yes, because the government is making a lot of efforts to promote community-based micro health insurance schemes, and that is why it is elaborated in the health sector strategic plan of Cameroon. Even though it is elaborated in the health sector strategic plan, I want to say that the will of the state is not yet expressly, out. The will of the state is not out. What do I mean by that? The sector is not yet regulated by the state. And so it makes it difficult for the population to have trust in these schemes for the uptake of the subscriptions. The other thing I would like to say here is that there is need for the Cameroon government to improve, especially on the quality of healthcare services and equity as well, for the population to really find what would satisfy them at the level of the health facilities, because sometimes the quality of health care services is not the best in some health facilities. Even though the government is making a lot of effort to improve the quality of healthcare services, like the introduction of performance-based financing that motivates the healthcare staff to deliver quality health services. Even the introduction of the voucher systems as well to improve on the uptake of issues of sexual and reproductive health and even delivery. Again, I want to say that the government could as well introduce taxation in Cameroon to finance health care services through community-based micro-insurance schemes. These insurance schemes that had existed, I take the example of the Kumbu Micro Health Insurance Scheme and the Boyo Micro Health Insurance Schemes that had existed since close to 20, the one of Kumbu is close to 20 years, and the one of Boyo is more than 10 years. And those schemes are still existing, even though at low key, unlike before when there was no crisis in the Northwest region. What I want to say is that if the government had contributed in promoting these schemes by way of communicating, by way of doing social marketing, by way of even doing proximity marketing of these schemes, like what we have in the Jangis and social groups here that are succeeding so well, I think that the mutual health organizations would have worked well. So what the government has done by way of introduction of performance-based financing and other schemes to improve on healthcare services in the health facilities is not yet enough. And I'm saying that there is need to regulate the sector. There is need to regulate this sector for people to believe in it, in order that the subscription should be high. There is need to introduce even a universal health coverage in Cameroon. There is dire need for that introduction of a universal healthcare coverage in Cameroon, and even to also introduce taxes of corporations like cigarette companies, the beer companies, the cocoa, and even corporations like MTN, the Orange, to contribute something to the state for it to be able to support this sector. Thank you.
Thank you very much, Madam, and I'm Mildred, for your contribution. Yeah, you've raised a couple of issues relating to government's contributions, as well as what else they could do, which is the last phase of our discussion. I'm still coming back to you to say more in terms of what the government could do more that is not doing now to promote insurance subscription. But I want you to say something briefly. I'm still with you, Madam Mildred. It just escaped my mind in terms of the situation of subscription into health insurance schemes. You mentioned something about in relation to the conflicts, the crisis, excuse me, that's going on in the Northwest region. Yes. And how has it affected the subscription of the schemes that exist there? Please, can you just say something briefly about it? Yes.
Those schemes, yes, subscription and even renewal of contributions for those who had registered before has been affected by the crisis, in that a good number of people have left their communities. They are internally displaced to other neighboring towns or even regions. And so, since they cannot repay their premiums in the localities where they had registered, the mutual health subscription is going down. Yes, that is how the crisis has affected the subscriptions in the mutual health organizations. And even the new members who would have been sensitized to buy the idea to enroll in the schemes have left the region. So some of them are living in neighboring regions like the West region, like Littoral, Yaoundé, and in other regions of other parts of Cameroon. As a result of that, since the schemes are existing only in their localities and functioning in those geographical localities, they are unable to access those villages to enroll in the scheme. So both the old and the new people who would have bought the idea have left. They are internally displaced. That's how it has affected the mutual health organizations. Thank you.
Okay. Thank you very much for that contribution. I think it's really, really important. I will consider beyond, I mean, the structural challenges are many, and each keep coming up to a couple of events that takes place in those communities. I want us to continue in this same light by looking at the case of private health insurance. And I want to go back to Dr. Ghislaine. I just want her to explain to us if there's anything that the government has been doing to promote the uptake of private health insurance schemes in Cameroon. And is there anything the government has been doing, and is it doing enough? Dr. Ghislaine, if you can throw light on that, I will be happy. I give the floor to you, please.
Ok, donc je disais, le gouvernement camerounais à l'évolution des compagnies d'assurance au Cameroun, parce que c'est déjà un monde assez concurrentiel, parce qu'il y en a beaucoup qui font dans le même secteur. Les compagnies d'assurance, à un moment donné, se rivalisent, ce qui fait qu'il y a un peu une concurrence souvent déloyale dans le monde de l'assurance maladie, assurance vie en général et assurance maladie en particulier. Il est important qu'il y ait une bonne collaboration entre le privé et le public, parce que le privé ne peut pas faire sans le public, parce que le public renvoie à l'État, et c'est l'État qui est la mère porteuse de tout ce qu'il peut avoir comme compagnie d'assurance au Cameroun. Donc, il est important qu'il y ait une bonne et franche collaboration entre l'État et tout ce qu'il y a comme entreprise publique. Il est important par ailleurs parce que dans les hôpitaux au Cameroun, le plus souvent, il y a il y a un souci au niveau de la qualité de soins parce que les personnes assurées qui vont même dans les hôpitaux ont un problème parce que non seulement les soins ne leur sont pas réservés à la manière des personnes qui sont assurées, mais en plus, ils se plaignent de la façon de fonctionner des compagnies d'assurance qui demandent souvent d'abord de payer avant d'être remboursé après. C'est-à-dire qu'on est assuré peut-être à 100% ou à 80%. Il faut payer d'abord les 20% pour ceux qui sont assurés à 80%. Vous devez payer les 20% et attendre payer la totalité et attendre que l'assurance vous rembourse le reliquat. C'est-à-dire que ma facture fait par exemple 200 000 francs à l'hôpital. On me dit paye tout et puis tu vas après faire un recours pour qu'on te rembourse 80%. Là, tu n'auras payé que 20%. C'est souvent compliqué. C'est compliqué pour les clients parce que c'est un système qui ne favorise pas l'émergence des compagnies d'assurance et de l'assurance maladie au Cameroun. Il est important que le gouvernement mette un peu plus en phase là-dessus pour faire comprendre que quand on s'assure, on a besoin d'être couvert, par exemple, à 20%. Donc, je vais avec mes 20%, je paye à la pharmacie ou à l'hôpital. Et le reliquat de 80% est supporté par mon assureur. Ça, c'est important de le savoir parce qu'il y a beaucoup de plaintes à ce niveau. Et maintenant, le gouvernement camerounais ne s'implique pas beaucoup dans ces mesures parce que même quand il y a des plaintes, jusqu'ici, il n'y a pas eu de mesures strictes qui aient été prises pour pouvoir assainir ce milieu, c'est-à-dire rendre les clients contents d'avoir leur assurance maladie. Voilà.
Okay, thank you very much for that contribution. I just want to briefly find out from you in terms of the uptake of private health insurance. There is this in relation to the health component. There is this issue of I mean, when people want to travel, they need insurance to be able to travel to different parts of the world. And that is a way, if people are not interested in private health insurance, they are forced to buy an insurance to be able to travel to their destinations as recommended by the receiving countries or their embassies. Can you say something about that? Is that boosting private health insurance uptakes in Cameroon? Okay, while waiting for Dr. Ghislaine to reconnect, she certainly has connection issues. I will turn to Dr. Hubert. We were coming to you, and unfortunately, your connection you got cut off, and you've come back. So we're just discussing the contributions of government in promoting health insurance schemes, be it the community-based health insurance schemes or the private health insurance schemes. So from your reading of the literature and your experience working in this domain, do you think governments are doing anything? And if they are doing anything, is it enough? Over to you, Dr.
All right, thank you very much. Very important question. My direct answer will be no. Governments in sub-Saharan Africa, Cameroon inclusive, have paid generally lip service to issues of health overall, to the fact that about 15% of budgets allocations being dedicated to health, according to the Abuja Declaration, have never been respected by any of our governments. And so it's more of, we pay a lot of lip service to health, with health insurance being a major vehicle to achieving the Sustainable Development Goal 3, also being largely neglected. And you realize that in the respective schemes, with that of Cameroon inclusive, the part of government, the roles that the government has to play in terms of financing the schemes are usually not forthcoming. And even if they have to reimburse in terms of the community-based facilities, this takes a long time. I'm in Ghana, and I can also give the country's example. For instance, they reimburse facilities when subscribers utilize services, and it's supposed to be quarterly, but some of the time, a whole year, payments have not been done. And so, per the literature and my experience in this field, I really think that our governments have a lot more roles to play. At least they should respect the Abuja Declaration of 15% of health budget going to health. And of course, once that is done, the government can even support the private sector to deliver better health services, because if there are incentives to shore off a lot of the burden the private entities have to take up, what it means is that they can reduce some of the premium that individuals have to pay to get subscribed to these schemes. So in a nutshell, I would say our governments, including that of Cameroon, have not really lived up to expectation over the years. It is not a single period, it's been consistent over the years, and that has largely affected health outputs overall. And we all have to play various roles in ensuring that things get better. Otherwise, my conclusion has always been that we will not be able to meet the sustainable development goal 3 by the year 2030. Thank you very much.
Okay, thank you so much, Dr. Hubert, for that contribution. Yeah, if I followed you, your conclusion is government has been doing very little, and there's a lot for them to do. We'll be coming back to that to get more in that light in the last part of this, which has to do with getting the general ideas in terms of what could be done, which is not currently going on with relation to the different stakeholders that are involved in the insurance scheme. So I want to come back to Dr. Ghislain. Yeah, Dr. Ghislain, vous êtes déconnecté. L'assurance privée pour le voyageur. Je sais qu'il y a la plupart, dans certains pays situés en Europe, qui exigent l'assurance, couverture de l'assurance pour un voyageur. Et la question que j'ai posée, c'est pour savoir si, est-ce que avec cette recommandation, est-ce que ça booste la substitution dans le domaine de l'assurance maladie privée?
D'accord, ok. En réalité, l'assurance voyage, c'est une assurance obligatoire parce qu'il y en a qui sont vraiment obligatoires, comme l'assurance automobile et l'assurance voyage. La seule chose positive, c'est que quand on souscrit à une assurance voyage, on se rapproche beaucoup plus du domaine de l'assurance. Mais chaque assurance a sa particularité parce que l'assurance voyage, elle est obligatoire. On ne peut pas aller dans un pays si on ne l'a pas. Tout comme l'assurance automobile, on peut se mettre en circulation sans assurance automobile. Mais pour ce qui est de l'assurance vie, c'est un peu comme on dit, l'assurance automobile, elle s'achète, mais l'assurance voyage, l'assurance vie et l'assurance maladie, elles se vendent. Parce que pour avoir une assurance maladie, il faudrait que la personne soit convaincue de ce qu'elle est en train de faire. Est-ce que c'est important pour moi? Est-ce qu'il est bon que je prenne une assurance pour ma vie, pour mes enfants, pour ma famille, pour ma maladie? Là, c'est au choix. Mais maintenant, la seule chose, le seul point positif, c'est que avec l'assurance voyage, on se rapproche beaucoup plus du domaine de l'assurance et on est plus enclin à prendre des contrats d'assurance vie parce que celui qui a une assurance voyage peut également avoir une assurance vie qui va le couvrir quand il est à l'étranger. Là, c'est un plus qu'il a. Mais l'assurance vie en général, elle n'est pas obligatoire et il faut toujours amener la personne à comprendre le bien fondé de l'assurance maladie ou de l'assurance vie. Il faut que la personne comprenne que tu peux payer un certain montant et te dire après un moment, je peux être malade et je vais souscrire. Malheureusement, au Cameroun, les Camerounais prennent beaucoup plus l'assurance vie pour des personnes déjà âgées. Ils aiment prendre l'assurance vie pour les parents, c'est-à-dire quelqu'un qui travaille parce qu'il est assuré dans son entreprise, n'ayant pas le choix. L'entreprise lui oblige d'avoir une assurance maladie. Il va s'assurer en maladie, mais pour l'assurance de ses enfants, il le fera en entreprise. ses parents, il va l'assurer ses parents parce qu'ils sont déjà âgés et il veut réduire les coûts, les dépenses qu'il peut avoir à faire pour la santé de ses parents. Donc, en fait, le monde de l'assurance maladie au Cameroun est assez complexe. Il est assez complexe et vraiment, comme on l'a dit tantôt, il appartient à ceux qui ont des revenus conséquents, qui peuvent leur permettre d'avoir une assurance maladie. Parce que là, c'est pour certains, c'est comme un luxe d'avoir une assurance maladie. Mais l'assurance voyage, elle ne coûte pas cher. C'est pour un mois, on va te dire, c'est 19 000. Tout le monde peut se prendre une assurance voyage. L'assurance automobile, on n'a pas le choix parce que la police va nous arrêter. Mais je pense que il y a beaucoup de méthodes, il y a encore à faire, il y a encore beaucoup à faire pour amener les Camerounais à comprendre que chaque type d'assurance a sa place dans la vie de chaque personne. Merci.
Merci, Madame. In the absence of Dr. Constantine, I think I'm going to take on the next question. And I'm going to call on Mr. Layo this time around. And Mr. Layo, I'd like to have you throw more light on this question. And would like to know how the government has contributed in enhancing access to community-based health insurance schemes. Mr. Layo?
Okay, Riza, thank you for giving me the floor once again. The government have put forth a lot of agendas, especially aiming at 2035 emergence to make universal access affordable in Cameroon and for Cameroonians to at least 40 to 41%. Now, what the government is doing to enhance this process is that the government is creating a coordination point to minimize risk pools and to take in the risk pools, governmental risk pools, to ensure that the premiums get a standard package for all and not defragmented packages. Because like one of the panelists said, we have insurance that are of different amount and for different purposes. So it is the role of the government to enhance and facilitate taxation for community-based or for private insurance to be able to carry on this task. In one of the way, we think that there should also be systematic collection of health data to evaluate conditions and measures that can measure results, because this is lacking in Cameroon, and often we do not get visibility of what the government is making plans for, because there is a lack of data to back up this. And also the government have been investing in some research so that they can enhance policy, social policies that can help improve the access to private health insurance. Another reason for government, or the contribution that government is giving, is establishing a financing mechanism so that the people who actually need the insurance the most be encouraged to visit the health facilities. This is also lacking in our social awareness systems, which we think that the government, though doing this, is not enough, but should reinforce these mechanisms to ensure that the neediest families benefit from the health insurance coverage for private scheme. And also, the government is also trying to do equitable distribution of healthcare personnel. As we know, the ratio of patient to doctor ratio is high, same as patient to nurse, and same as even as specialists, which we are still lacking much in Cameroon, as most of the specialists like to live in urban area where they can make fast cash. So this deprives the services that are really needed in hard to reach areas, which is a challenge. In as much as government is agendas are looking toward achieving this objective, a lot is still needed to be done to make sure that this healthcare reach the people. Also, we know that there are subsidies that the government is given to a private health scheme to ensure that they are partners and collaborators of the state in fulfilling this particular mission of attaining universal health coverage. Notwithstanding that government is making a minimal progress and a lot still needed to be done, because some of the decisions taken by the government with regards to this health insurance are not fact-based. I would say not oriented by data. So let the decisions that are interministerial decision concerning health, concerning financing, concerning this, be actively put the customer or the beneficiary of health services in the center of it. And I think that through that, we will be ensuring that equitable implications are given the right role in achieving a private health insurance scheme. Thank you, and over.
Thank you very much, Mr. Layo, and thank you for highlighting some of the strides that have been made by the government to improve the private health insurance. So, Dr. Constantine, are you back?
Yes, I'm back. Sorry. Mr. Layo, he has been making contributions as to what as of the things the government can do to boost insurance uptake or to improve subscription into existing health insurance schemes in Cameroon. And that is the last part of our discussions. So, and we'll move around with this to get the contributions, what other panelists can say in terms of what governments can do that they are not doing. So I want to go to give the floor to Madam Mildred, as far as community-based health insurance schemes are concerned. What is it in practical terms, if you were to call by the Cameroon government, for example, to say, what is it that we can do to increase subscription? What would you actually tell them? You have the floor, madam.
What the government needs to do. Am I being heard now?
Yes, yes, we can hear you, madam.
Yes, the government needs to regulate the sector in order to build on trust and confidence of the population to subscribe to the community-based micro health insurance schemes. That is the first thing. And equally, the government needs to put their voice in relation to communication and social marketing of the scheme. Once they come in to encourage the population to enroll in their different localities, in their different health areas, in their different health districts, people will believe more in the schemes. And I said already that there is equally need to improve the quality of healthcare services and even equity, issues of equity at the level of the health facilities. There is need for improvement of quality of healthcare. That way, people who are insured would have what they want from the health facilities, and that would also continue to motivate them to pay their premiums regularly. Those are the points I think the government needs to do. And equally give subsidies to the existing mutual health organization schemes for sustainability, because the schemes that were created in the Northwest region here are functioning only with the finances collected from the population as premium. And as a result of that, the schemes are still very, very low key, not really operating at a very high level as expected. But if the government could come in with subsidies, maybe to assist the schemes to improve on sensitization, to penetrate the communities and give the information, more knowledge would be increased at the level of the populations, and so more people would enroll in the schemes, and that would equally guarantee the sustainability of the schemes. So those are some of the things that I think the government needs to do to improve on the situation as of now. Thank you.
Okay, thank you very much for your contributions. Let me pass. We don't have much time because we are rounding up to give room for some questions if they are available. So I want to move to Dr. Ghislaine just to get to hear what is it that the government can do to improve or increase subscription into private health insurance schemes in Cameroon from my experience. Dr. Ghislaine, you have the floor, please.
En réalité, tout repose vraiment sur le gouvernement parce que ce n'est que l'État qui régit le monde de l'assurance vie au Cameroun et de l'assurance maladie. Je le dis tout le temps, l'assurance vie et l'assurance maladie, alors toutes les autres formes d'assurance qu'on peut avoir, ne peuvent fonctionner que si la CIMA, qui est la Conférence interafricaine des marchés d'assurance, respecte réellement la réglementation. Ça, c'est très important parce que le monde de l'assurance maladie est un monde assez flou parce que les compagnies d'assurance se font une concurrence qui n'est pas aussi déloyale que je l'ai dit tantôt, mais une concurrence qui donne à un moment donné l'impression que on suit des règles, mais après, il y a des règles en interne que chaque compagnie peut respecter, peut suivre. C'est-à-dire, moi, j'interpelle le gouvernement au niveau par exemple, des taxes, parce que le gouvernement camerounais n'encourage pas beaucoup les clients ou alors les Camerounais à prendre des contrats d'assurance dans la mesure où on a imposé une taxe supplémentaire aux polices d'assurance, qu'elles soient automobiles ou vie ou maladie. Il y a une taxe supplémentaire qui a été ajoutée. Ce n'est pas, c'est vrai qu'on a donné la taxe audiovisuelle et tout le reste, mais dans un domaine aussi délicat et aussi encore peu exploré par les Camerounais, je pense que c'était pas une bonne décision à prendre pour le moment parce que en augmentant la taxe, ça fait en sorte que la prime d'assurance augmente. C'est-à-dire, déjà, il n'y a pas l'argent pour prendre un contrat d'assurance. Maintenant, s'il faut augmenter une taxe supplémentaire, ça fait que le Camerounais qui doit se battre pour avoir son assurance doit en plus augmenter ses revenus pour pouvoir couvrir sa famille. Imaginez-vous quelqu'un qui doit s'assurer, lui, sa femme et tous ses enfants. Une augmentation de la taxe va le décourager à un moment donné. Donc, ce n'est pas faciliter le travail des assureurs et la souscription des potentiels clients parce qu'ils ont besoin d'être mis en confiance. Le Camerounais n'a pas encore totalement la culture de l'assurance. Donc, c'est tout doucement qu'il faut l'amener à comprendre le bien fondé de l'assurance. Et j'ai parlé tantôt d'une bonne collaboration entre le public et le privé. C'est-à-dire, c'est le public qui doit donner un peu de temps au privé, aux assurances privées, pour pouvoir faire ce travail parce que les assurances privées aident un peu le pouvoir et l'État à faire une partie de leur travail parce que ce n'est pas évident de couvrir toute la communauté. Les mutuelles d'assurance, par exemple, qui se forment sont d'une grande importance parce que ça aide les populations et ça aide l'État à prendre en charge les problèmes de santé d'une population précise. Parce qu'en se mettant ensemble, elles peuvent se soutenir et n'ont plus besoin du soutien de l'État à ce moment. Donc, l'État doit prendre ça en considération et se dire que si les personnes peuvent le faire, nous devons les accompagner. On doit les accompagner déjà avec un bon système de santé parce que si vous vous réunissez pour mettre un peu d'argent de côté en commun et garantir vos soins médicaux et tout le reste pour vos enfants et pour vous-même, il est important que quand vous allez arriver à l'hôpital, que le système sanitaire, que les professionnels de santé soient là pour vous accompagner, qu'ils soient là, qu'il y ait un système qui soit mis sur pied pour que lorsqu'on rencontre des mutuelles de santé, que les professionnels de santé les prennent avec beaucoup de délicatesse. C'est-à-dire, on leur accorde une prise en charge vraiment de qualité. Voilà.
Okay, thank you very much. Okay, thank you very much, Dr. Ghislaine, for that wonderful contribution. Yeah, because of time now, we'll give room for some the question and answer sessions and give room for questions for those who want to have some questions. From my end, I don't see any question on the chat box. I don't know, Raisa, if there are questions. And please just to indicate that if you want to ask your question, indicate the panelists in which what your question is directed to. Are there questions?
There are no questions.
Okay, there are no questions. Okay. So we'll be rounding up now in the last phase. We are just we're rounding up, and I want to give the floor again to Dr. Hubert in terms of what is it that government can do, or what is it that can be done, not just government alone. We've discussed all the issues concerning low subscription, and I mean the observation is that subscription is low. Yes, that's even why we have this discussion. And these schemes are there, and they are not living to expectations or performing the role in which they have been encouraged. They were set up to perform, and therefore that calls for concern. We've discussed all the issues in terms of from the side of the government and other structural and economic challenges that hamper subscription. So now I want to find out what is it that can be done. Yeah. What can we do to boost subscription, irrespective of the insurance scheme, be it in private or be it in community-based health insurance? Dr. Bay, you have the floor.
Okay, thank you very much, Doc, for the opportunity. What can we do to improve subscription? I think that's the whole discussion we've been having, and I'm happy that Mildred and Layo has mentioned a lot of this, so there's very little to talk about. But then I would highlight again the need for social education. We need to get the information down to the grassroots, to the last mile. How essential is subscribing to health insurance to you, the individual? What are the risks that you are being protected against should you be subscribed to health insurance? I think social education is essential, but then the form of education we are doing is important. How are we disseminating the information? Is it through radio or other means? We need to find the appropriate ways of getting education to the last mile, because that is the only way that the uneducated, which constitute a large chunk of the Cameroonian population, will get to really understand the need. Because no matter what we do, we can increase budgetary allocations to 15%. We can support the private sector with subsidies, which is highly recommendable. But then if people do not understand the need to subscribe to the scheme, it will be a challenge. Because one of the things that I'm based in Ghana, that the country has done to widen the subscriber base, and I should say Ghana has one of the highest subscription to health insurance in the whole of Sub-Saharan Africa. And what the government has done is to widen the exemptions policy, where pregnant women do not pay anything. People who are government workers, monies are deducted directly from source. So it means that they do not have to pay anything. The indigent are covered. I mean, people highly behind the poverty line are also covered. But then for these people to understand the need to be enrolled onto the scheme, then we need to really get education down to them. So the various institutions that are responsible have a role to play. The society in general, the media, community leaders, religious leaders. We should find a way of engaging all of these stakeholders holistically so that they all support to help us raise awareness, education on the relevance of subscribing to insurance, with the idea that when you need help most and you probably do not have the need financially at that particular time, that is when health insurance becomes essential to you. Now, it may be difficult, but then one thing that works for holistic health insurance system to work is harmonization of various splinter schemes. I don't know how feasible that is, but that is something that the government could consider to harmonize a lot of the schemes to see if risk pooling is done. It helps to offshore a lot of the burdens that the various minor schemes do have to take up. And so harmonizing of the various schemes is very important because it helps a lot in risk pooling, which was earlier mentioned by one of the panelists. I believe that if these and others are done, including, you know, a lot of our focus has been on the government, but what has the health system itself been able to do? The health facility, what are they doing? And I'm happy that one panelist talked about trust. How do we increase trust in the health system? Are people more of the idea that when I come to the health system, my rights are abused, I am not respected, or do I have insurance and when I come, I am still made to pay out of pockets for health services? Because in studies we have done, people have indicated that they have the insurance, they have paid their premiums, but when they go to access care, delivery out of, at the point of delivery, they still pay before they are given health service. So do people have the right trust in the system that when they subscribe, they will get value for their money? I think these are questions that if we are able to address them effectively, would help us see a show up in the numbers with regards to subscription. Thank you very much. Over.
Okay, thank you so much, Dr. Hubert, for your contributions in terms of what can be done. We are gradually getting to the end of this discussion, and I want to go back to Madam Mildred. In your recommendations, you said one of the first points you made was that the government of Cameroon needs to regulate this sector. Can you throw more light when you say regulate this sector? What exactly do you mean? For example, can you say something in relation to that, Madam Mildred?
Yes, thank you, Doctor. Regarding the issue of regulation, I take the example of the Northwest region where there are different promoters of community-based micro-health insurance schemes. We have those micro-health insurance schemes that are promoted by the Northwest Regional Fund for Health Promotion, supported by GIZ. We have those that are promoted by BEFA, the Catholic bishops, and also those that are promoted by other promoters. And when you get into the management of these mutual health, you realize that there are different pricing mechanisms and there are different procedures of even benefiting at the level of the health facilities. And so those differences make the population to think that those mutual health organizations are businesses put in place by particular individuals. So the government needs to come out with a law regulating the sector. Like somebody said already, there is need for a degree of harmonization in terms of the packages, in terms of the services, the products, in terms of the price of the product and all of that. So there is need for a degree of harmony such that the language is understood, the language of health insurance and risk sharing as well as uncertainties is understood by even the illiterate. Because at the same time, since there is no harmonization, most people, illiterates, for example, who cannot understand the importance of risk pooling mechanisms, would think that it's businesses by particular individuals, and at the end of the day, they just watch and they don't feel like belonging. So there is need for the government to come out with a law regarding these community-based micro-health insurance schemes. Thank you.
Okay, yeah, just the very last question, just a short response. Do you think if government makes community-based health insurance an obligation, not leaving it voluntary as it is now, do you think it is going to have a positive impact in terms of its performance?
Yes, that can be very possible if they target the formal as well as the informal economy, the formal and the informal sectors, where for the formal sector, they will be able to deduct the premiums from those who are the workers in the private sector and the public sector. And then that scheme would have a relationship with the informal economy. I think that can lead to success in this domain.
Okay, thank you very much for that clarification. Now we are gradually dropping to the end, and so we just want to get a word from each and every one of you. I mean, you've said a lot of things, and if you just one last word, let's take a tour around, beginning with Mr. Liu Donatus.
Okay, Dr. Constantine, thank you for giving me the floor. And once more, it was a fruitful discussion, and I was glad to be part of this great discussion and great initiative that impacts actually the public health and the health of Cameroonians in general, and to discuss the various ways in which we can improve the uptake of subscription to community as well as private health insurance scheme in our country. I think I would just like to add that in one of what government could do was to do an alignment that providers can get their incentives to avoid the myth that the healthcare providers are scaring beneficiaries from receiving the best services that they can provide. Some of these we have. I have an experience of supervising a PBF project, and this was one of the resentment that comes back and that keeps coming over and over. And I think that our contributions to these discussions will go a long way to help inform policies in Cameroon and also in CAFU Institute.
Okay, thank you very much, Dr. Liu. Docteur Jocelyn, un dernier mot, s'il vous plaît. Soyez bref, pardon.
Je suis contente d'avoir fait partie des panélistes de cet échange. Et comme j'ai dit depuis le début, la santé, c'est quelque chose de primordial pour tout être humain. C'est-à-dire, le Camerounais a besoin d'être en santé. Et c'est base, c'est les choses basiques que l'État doit pouvoir garantir à ses citoyens. Je pense que c'est tout à fait naturel de garantir des mesures qui permettront aux Camerounais de ne pas avoir de soucis pour passer à leurs occupations. La santé fait partie des besoins physiologiques de base.
Okay, thank you very much.
Le gouvernement...
Thank you so much. Dr. Hubert, one last word, please. Just 1 second, please.
Okay, so thank you very much. In a country where about 90% of the populace, according to literature, do not pay taxes, there is an important need for the government to widen the tax net. When this happens, there will be enough to securely finance health insurance by also harmonizing various splinter schemes. When that happens, there will be improved risk pooling, and this will give people guarantee in the fact that when they subscribe, they will get value for their subscription, and they will actually get the quality of services that they need to get. So I believe when these and others are done, plus social health education for people to really understand the relevance of subscribing to health insurance schemes, definitely you will see the numbers going up in the years to come.
Thank you so much. Thank you so much. Madam Mildred?
Yes,
One second.
yes. The government should promote community-based micro health insurance schemes because they are very, very important as they play a role in reduction of out-of-pocket payments, thereby making a huge contribution in health outcomes like reduction of mortality, reduction of mobility, and all of that. Thank you.
Okay, thank you very much. From what we've known about this throughout this conversation, there are a lot of barriers hindering Cameroonians from subscribing into private health insurance schemes and community-based health insurance schemes. And there's a lot that the government needs to do to be able to boost subscription. We want to thank you very much, all the panelists, for your time and your contributions that you have made in these discussions. And we really pray that, Father, we will continue to be at our doors each time we come back to you to solicit your assistance. So we thank the audiences for participating, and we thank everyone. And we've brought this this webinar to an end. Thank you very much. Raisa, over to you.
Thank you very much, Dr. Constantine. A special appreciation to all our panelists for taking out time to share with us their knowledge on this topic. We look forward to having more conversations on this topic as we seek to promote private health insurance in Cameroon and Africa in general. To all our participants, once again, thank you for joining us, and we hope you always join us for these conversations. I wish us all a very happy weekend and see you next time.